Hello, Utica Park Clinic. This is Amy Coatney and Sam Thomas here. We're going to be talking a little bit about advanced directives. Some of this, I'm sure, will be a review to you all, but this is something that we are looking at right now. So thank you for dialing in. We're going to get started here in just about a minute. We'll wait. And well, no, it's 12:30, so we'll go ahead and get started. Okay, so we are talking about advanced directives today. A lot of this is from the perspective of the patient and things that they may be interested in, ways to talk to them about this, and the importance of getting an advanced directive, as well as a few review items for those of us who are collecting them. All right, so a lot of this we're just going to kind of go over what an advanced directive is and the importance of it, how it works, and answer some of the kind of commonly asked questions. So just for starters, who can execute this is obviously the patient if they have the capacity to do so. This basic rundown is this talks about the patient's wishes regarding their medical treatment, including all life-sustaining treatments. It appoints representatives to make decisions for them in case that they're not able to do that themselves. And it just kind of documents all their final wishes, what they want to do as far as like body donation, how they'd like to see the transition handled. The requirements are the patient needs to be at least 18 years old. It has to be signed by 2 witnesses who are 18 years old, are not going to be inheriting anything from the patient. No notary is required. It's a very simple process. I did one with one of our care coordinators just the other day as she ran right through it, and there were 2 of us there to sign it. And when it takes effect is really as soon as we get it into the system. So this is kind of just the basic encompassing definition that we're going off of. It authorizes a healthcare proxy to make decisions on behalf of an incapacitated patient. This is here, and we've listed some of the commonly asked questions or concerns, and we're going to kind of go through some of these and say how that they can benefit when you're talking to a patient.
So one of the first common questions that we have here is, why should I complete an advanced healthcare directive? And I think it's basically so the person who is at end of life has a decision-making process in what they would like done. Do they want life support? Do they want to be hooked up to a ventilator? But also, too, it's giving the patient an opportunity to discuss this with their loved ones and their friends, someone who's close to them. So at the end of life, everyone is on the same page as to what your wishes are. And I think really this takes a lot of responsibility off of the family members because they're not left guessing what needs to be done. It's already been discussed, and everyone is on the same page with the plan. Next question, why don't doctors make all the end-of-life decisions? So as we all know, doctors can tell you about your medical condition and they can tell you about the different options that are available, but when it comes right down to it, the doctor is just there to provide guidance. You are the decision maker of your own fate, and if you become incapacitated at a certain point to where you're not able to make that decision, then you've designated someone who knows what your wishes are and can make that decision for you. One good thing to remember too is it doesn't have to be a family member. It can be someone who's close to you. So it could be a close friend. It could even be a neighbor if you feel comfortable with that. Verda brought up a good point. We had a patient ask us when we were at the Senior Elite Health Fair. I think people see DNRs and don't understand the difference between. But she was concerned about filling one out because her grandson wasn't 18 years old yet, and so she wanted to make sure that he was placed on that form. While you do have to be 18 years of age to be a healthcare proxy, it doesn't have to be the grandson or the son or a direct family member. But another good point with that is, too, is if she wanted to name someone until her grandson became 18 years of age, then she can update it and revoke this one at any time. So it's not set in stone. If your wishes change or something happens, you want something to be different, you can always fill out a new form, disregard the other one.
So I feel like this is one that I hear a lot when I'm talking to patients is, well, if I end up in the hospital, the doctors will make the decisions, they'll know what to do, they'll know what's best. And this is a really good opportunity to kind of, where you can individually educate a patient about what that may look like as far as their treatment trajectory, some of the things that may happen. And, you know, after they kind of hear some of that, after they learn, it's kind of a taking control of your own health process. And it's a really good, it's just one of those good ways to say, like, you know, this is a good way to take control of your managing your own health and affairs, because there's some things that you may not want that doctors will do otherwise.
Okay, so why should I share my values and beliefs? And this is kind of what we've been discussing. But going back to, it's good for your family and close friends to know what you want done regarding the quality of your end-of-life care. Like knowing you in this time, make sure your wishes are carried out, and then it also alleviates the stress off of family members at the very end, trying to decide what needs to be done or what you would have liked to have happened.
And this is really a good one for introducing. You know, we have a lot of patients, or I've seen many who are resistant to filling out these forms for one reason or another. And this is a glaring one that I think is very easy to help out with. Yesterday I spoke with a patient, and when I mentioned the idea of an advance directive, he said, my wife knows exactly what to do. And she was sitting in the room, and she said, I actually do not. I'm not sure at all what you would like. And it was this great moment to say, like, this is something you should talk to your family about. We can bring everybody in, you know, because if you haven't talked about it, then ultimately your family may or may not know. And it really is a great tool for being able to take off the burden of responsibility in those critical moments.
So what kinds of things can you write on your advanced healthcare directive? You can write your preferences about refusing or accepting life-sustaining treatments, CPR, feeding tubes, breathing machines. If you'd like any pain medication, are you going to be making any organ donations? If so, specifically, what parts of the body do you want to donate? And then also you can even indicate who you would like your primary doctor to be during this time. And do I need an attorney to help with this? You do not need an attorney to help with your advance directive. It is just, and we've actually got a link to the form later on in the presentation, but it's as simple as a form that you can print off, fill out, and you just have to name your healthcare proxy. You can actually even name 2 healthcare proxies, I believe. You can have one healthcare proxy and then an alternate, or the 2 can share this responsibility, and just 2 witnesses to sign the form, so you don't even have it notarized. So a durable power of attorney, we just wanted to go over really quick. This would be more so appointing someone to make a financial and or healthcare decision. You do have to have a notary that is required for this. So, and this does not grant us authority for making any life-sustaining treatment decisions. So that's where it differs in the advanced healthcare directive. A DNR consent is do not resuscitate. This is if the patient lacks capacity, and attorney or healthcare proxy, guardian of the person or attending physician is the one who can execute this. It is the patient's wish to receive or not receive CPR or some sort of intervention to restart the heart or breathing function. This is no notary required. And then here is a link to our website for population health. If you guys have any questions, always feel free to contact Sam and I. You can message us through InBasket, email us. Patients can email us through this website. Whichever we can get the referral, we will take it, whichever way.
So this kind of goes back into more specific things for population health. If you do need any assistance with these or like guidance in talking to your patients, feel free to contact us. We can help go over the forms with them. We can join you as we do it together. Life Senior Services is also an excellent resource to send patients to if they have kind of questions about this and the process. They offer classes on the importance of all three, having an advanced directive, having a DNR, and a power of attorney, and some of the scenarios. They do a really good job at educating what scenarios you may need these for and how they can come in, how they can be useful, like seeing how it can relate to your patient's life. This is also like something to talk about in with the MyChart communication. This is something that you can give the patient control access to. Like this is just another way to take control of their own health. So we talked about some of the best practices for doing this, and I know that each clinic probably has an individual way of addressing it, but one way that we thought might work best is just during that first encounter of the new year, when you're taking care of other forms and paperwork, checking their chart and saying, hey, do you have an advanced directive? Is this something that you may be interested in? We have people that can go over this with you and kind of explain the importance of it and meet with you. And we are going to now show you an easy way in Epic, for those of you who have not seen it, where you can find whether or not they have that advanced directive already. So if you go into a patient's chart, under demographics, you can find the advanced directives tab and see whether or not there is one. In this patient's case, they do not have one in yet. So when you see that on a patient that during your maybe pre-visit planning or during that first time during the year, maybe stop and talk to them and say, hey, I noticed that you didn't have an advanced directive. These are some of the reasons this is something important to think about. And kind of go over. So this is, we're not going to really use this one because we've taken some screenshots, but at uticaparkclinic.com, under resources, you can find a series of videos that patients can access that talk about the importance of having these forms completed, as well as we have those forms on our website available, and we'll show you exactly where you can find those and where patients can as well, if it's something that they are interested in completing on their own. So you would go for our patients, and under these sidebar tabs, we have end-of-life planning and patient forms. The forms are under patient forms there, but the end-of-life planning is a series of videos that talk about the importance of end-of-life planning, the importance of having these forms, and it's just an excellent resource for both us and patients to utilize. Additionally, if you get on the website, Utica Park Clinic, or you don't want to go through there, you can easily Google Oklahoma Advanced Directive, and it will lead you straight to the DHS link where you can find it and print them off. This is the patient forms page. You can see here where it says Living Will and Advanced Directive Forms. They're all under there on our website. Easy to find. And right here we have the beginning example of Living Will and the very long link in where to find it. So I don't know that you all want to write that down. But again, if you just do a search engine for Oklahoma Advanced Directive, it's going to direct you to the page where you can find this and easily print it off. A few final words kind of about this. This is our plug moment. If you're going through Epic and you see that our names are attached as care under the care team, that's something you can contact us for. We'd like to remind you guys that if you're seeing patients with a PHQ-2 of greater than 3, to please request social service for kind of a behavioral health plan assessment if they're at all willing. We always like to talk about our telehealth services for counseling. We really would love it if you guys were pushing those out there. We have some clinics that we're receiving them from, but we've kind of been a little slow on that this year, which is fine. But we really are trying to press for that kind of, and I know a lot of patients can be slightly resistive to it. But if that's the case, just give us their number, and we're willing to call them and talk them through exactly how easy it is. Our documentation can be seen in the notes. If you have any questions for critical issues, we'll be getting right back to the provider or whoever sent it to us. And that being said, please don't hang up just yet. We have another additional presentation by our fearless leader, Verda Weston, here in just one moment. Thank you guys for your time, and please email us if you have any questions or concerns. I know many of you guys are out there doing these all the time, so you're old pros at it, but we are here to help if we are at all needed. And without any further ado, Verda Weston.
Thank you, Tim and Amy. I'm actually going to, we're actually going to call this good. They did a great job of reviewing information. One piece of information for you is in the Year 2 scope of work for CPC Plus. Advanced directives and advanced care planning really are a project that we are required to undertake and discuss, so this begins part of your education. We have targeted populations with CHF, COPD, and oncology services as people that we need to focus on having discussions more with advanced care planning. But please, 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 keep Amy and Sam busy, and they're available to come out to the clinic, help you anyway, and absolutely maximize telehealth. Thank you guys so much for coming. Enjoy your afternoon, and we'll talk to you soon.